the nation to share my perspective on our experience with women and the HIV and AIDS epidemic. In 2 weeks' time, Rwanda will commemorate the genocide against the Tutsi. As you may know, ladies and gentlemen, 21 years ago, Rwanda experienced the worst forms of violence during the genocide. For decades and decades, the leadership told people to hate, dehumanize, and to kill. What our country suffered in the 1994 genocide is beyond human comprehension. 1 million Tutsi, men, women, and children were massacred, and that is 15% of the total population. Some moderate Hutu were killed, hundreds of thousands of women brutally raped and infected with HIV and AIDS. There were even doctors who injected patients with HIV-infected blood. 300 to 400,000 genocide survivors, 50,000 widows, and 36% of households headed by widows, 75,000 orphans, and 28,000 households headed by children. So assessing the magnitude of our loss compelled us to build a new and different Rwanda. We understood this daunting task of repairing our ruined nation. This entailed the restoration of the dignity of all Rwandans, and our leadership readied its people to be self-reliant, to be purposely driven, to revive the dreams and hopes that were lost to this tragedy. Against the backdrop of a genocide legacy, our nation's response to HIV and AIDS became even more complex. Nevertheless, with committed and forward-looking leadership, we were convinced that addressing the issue of women and HIV and AIDS, among other pressing matters we had to manage, would be more effective if we took a holistic approach, one that combined laws and policies with the implementation of various programs that favored women and girls. Allow me to highlight some of them. So it's a constitutional requirement that at least 30% of women hold decision-making positions in public institutions. Rwanda enjoys the highest female legislative representation worldwide at 64%. 40% of the cabinet and judiciary is comprised of women. We have a law that stipulates the legal marriage age at 21 years, and this law was enacted to protect adolescent girls from early marriages and the consequences that often attached to this. An inheritance law that grants equal inheritance rights to men and women was passed, which is one of the things that it's a contributing factor in the spread of HIV. Rwanda was the first African country where the HPV vaccine was administered. Today, 93% of our girls aged 12 to 17 are vaccinated for cervical cancer. Cervical cancer kills almost as many women as death during childbirth. The girls' enrollment rate at primary school is at 98%. The PMTCT services available in 27% of all health centers, and because of the success of PMTCT, we have managed to reduce HIV transmission to 2%. HIV testing among young women has increased from about 10% in 2005 to almost 60% in 2010. And in response to gender-based violence, a one-stop center was created where trained social workers, medical doctors, lawyers, mental health workers, and police officers provide psychosocial, medical, judicial, and legal services to victims of the violence. There are safe rooms where victims can remain until they can return to a secure environment. Community-based health insurance adherence is at 73% as of 2013-2014. We have 445,000 community health workers who raise awareness in communities about HIV prevention, testing and adherence to treatment, and 2/3 of them are women. We have instituted a system of maternal death audits, whereby investigations surrounding the circumstances of a woman's death during childbirth are conducted. And after analyzing the results, practical solutions for preventing future fatalities are recommended. And this has contributed to a reduction in maternal mortality from 8 deaths a day to less than 1 every day.